All right, today we're going to introduce light therapy, or phototherapy as it's now being referred to. There are 6 primary avenues of light therapy. First one being lasers, light emitting diodes, LEDs, superluminous diodes, fluorescent lamps, infrared, and UV light. We're going to focus on lasers in this lecture today. So as we move on to case studies in the next few weeks, lasers will perhaps be an option that we would want to choose as a modality for treatment, and we'll talk about the indications for phototherapy. So lasers stand for it's an acronym for light amplification by stimulated emission of radiation. It's a device that controls the way that energized atoms release photons, and we'll talk about that in more detail in a few minutes. But they are of a specific wavelength, and when absorbed, will cause specific physiological responses in the body. So we could say that laser lights are monochromatic because they are of a single color, and therefore the absorption can be targeted to specific tissues and chromosomes. They're monophasic. A laser is of a single wavelength. A laser is coherent, so the photons travel in the same direction at the same time. And laser light is non-divergent, so it can be used to treat a small area, unlike a flashlight that has a divergent beam, which spreads out and goes in many different directions. Lasers stay focused in one area. History of phototherapy is that sunlight therapy has been used to improve health for centuries. Solariums were used by the Greeks and the Romans. But in the 1960s, the lasers, when they were being used to remove a cancerous lesion, it was found accidentally that they actually helped in the incision healing process. And that was at a lower level of intensity, and so we're going to go kind of in that direction as far as what lasers are used for in therapy. There's 2 general types of lasers. There's hot lasers, which are used surgically for the purpose of cutting and destroying tissue, and are considered a class 4 laser. Cold laser is therapeutic laser created for tissue healing. It doesn't destroy or damage the tissue. It also doesn't create any heat. Indications for laser therapy primarily is wound and tissue healing. It's been known, or there have been claims, that it can relieve pain. However, those have been unsubstantiated. Some of the literature on lasers lists the following for uses in treatment for wounds: carpal tunnel syndrome, epicondylitis, TMJ disorders, bone injuries, arthritis, tendonitis, nerve injury, sprains, strains, burns, chronic pain, trigger points, and dermatitis, which seems to encapsulate pretty much everything that you could possibly see in healthcare, with the exception of some symptomatic issues. So we laugh sometimes that lasers can be used, or it's claimed that they can be used by the producers to treat anything. That's kind of a running joke that you might hear around. If you're not sure what modality to use a laser. However, these uses are not substantiated by literature. So if we're going to use them for these purposes, we really are not practicing evidence-based medicine. So the use of lasers at this point will be used primarily for wound and tissue healing, and sometimes some pain relief. There is some literature, but again, not a lot to substantiate that use. Over the years, though, I expect that will change as more research is done in regards to lasers. Contraindications include irradiation to the eye or the uterus during pregnancy, cancer, organ transplant patients, over the thyroid gland, and with epileptic patients. Effects, primarily, again, tissue healing. They enhance the contraction of wounds, the healing of ulcerations. The nerves have been found to regenerate somewhat. And in regards to pain, again, the research is inconclusive. Here I have found a few YouTube videos. Hopefully you can click on these. I'll have to check that later so that you can watch low-level laser therapy being utilized for wound healing. It's also being used on the second clip for a hamstring tear and then for neck pain. So if you can't get into those, if it doesn't click in, we'll watch those at a later time together in class. But hopefully, if you can pause this and then click in and pull up these videos of the use of laser therapy. All right, so let's talk specifically about what happens in a laser, or how this has come about to work. So here we have a picture inside of an atom, and we have our electrons and then the nucleus right in the center, and the electrons moving in orbit around it. So these atoms are in constant motion. They're continually vibrating, moving, rotating, and can be in different states of what they call excitation. In other words, then they can have different energy. If we apply a lot of energy to an atom, it can leave what is called the ground state energy level and go to what is called an excited level of energy. And if we apply some heat to an atom, such as lasers, heat becomes our medium, and this is applied usually as a gas or a liquid. We might expect that some of the electrons from a lower energy orbitals would then transition to a higher energy orbital. As we see in this picture, this electron is jumping up to a higher orbit, further away from the nucleus, by the application of heat through laser therapy. Would be one example to using it. Then as the, I think this is the same, there we go. So as the electron begins to what we call relax, it in turn rids itself then of some of the energy, and this energy is emitted in the form of a photon, or light energy. The photon emitted has a really specific wavelength, and therefore a very specific color that depends on the state of the electron's energy when that photon was released. Two identical atoms then, with electrons in identical states, will then release photons with an identical wavelength. Okay, so what we have in this picture is a tube here, and we have a gas inside of it, and these little green and purple balls denote photons. So the majority of the photons then, as they leave and these electrons move to a different state of orbit, the photon is released, or it comes out of the tube, so it exits this chamber. At the ends here we have mirrors on each end of the tube, and so most of these photons don't hit the mirror. Most of them actually escape completely. However, some of them will hit the mirror. So if we looked closely at this green one here, kind of in the middle, and we followed it along, and we could project that eventually it would hit this mirror on the right end and then bounce back. So that energy is not being reflected out of the chamber. It's actually in the chamber. So we get kind of a pattern like this. So as that photon strikes the mirror at a right angle and is reflected back towards the second mirror on the opposite side of the tube, we get this process in which the photons then stimulate other electrons to make that downward energy jump from one orbit to a lower orbit, and then it can cause the emission of more photons of that exact same wavelength and phase. And then we get a cascading effect that occurs, and soon we've propagated many different photons of the same wavelength and same phase to be moving in this tube and being bounced back and forth between the mirrors. In a real laser, though, one mirror at one end is what is called half slivered, so it's not a full mirror. It's got some open space into it, so that as the photons strike this mirror and they come back, some of those photons are going to be coming out of that slivered, or that kind of escape door on the end, and so the light will then pass through, and that's then what we see as the actual laser light that then will be used to treat the wound or whatever area that we've chosen to treat. So this is what it looks like from the outside then as this light comes through and then is directed through the skin in a really focused, coherent way. And then as we go through different tissues, you can see that it does diverge a little bit the deeper that you get. So what's the mechanism of action that we're looking for? But the photons then are absorbed by photoreceptors in the tissue cells, and they cause a change in the photoreceptors' molecular configuration, and then it alters the cell's molecular processes. Once the cells then are stimulated to produce an enzyme with the low-level laser therapy, the adjacent cells then are stimulated by the presence of the newly produced enzymes, and we get this cascading effect to also produce the same chemical and effectively duplicating and enlarging the effects of the light stimulation. The enzymes produced are those that are naturally used and produced by the cell, so it's not any sort of fake chemical or anything that's being introduced from the outside. Every cell in the body has light-sensitive chemicals, and those are called cytochromes. These chemicals are located in the energy compartment in the cell, which is the mitochondria. And when you stimulate the cytochromes with the correct wavelength and the power of light, it provides the cell with extra energy to grow, regeneration, and healing. This biochemical reaction increases the production of ATP. And really, bottom line, that's what we're looking at. That's what we're looking for. If we can increase the production of ATP, it initiates vasodilation, which then brings in oxygen-rich blood to the injured area, and we have better healing. So in summary, we have measurable effects of low-level laser therapy appearing in the calcium ion channels, the RNA and the DNA at the cell level, and the production of protein, fibroblasts, lymphocytes, and leukocytes. So what I'd like you to remember from this is the use of low-level therapy, increasing ATP availability, causing vasodilation, which brings in energy, and then we have measurable differences in all these cell processes, which lead to better healing or quicker healing. Low-level laser therapy does not damage the skin, it's not invasive, and it really has no known side effects if used appropriately. Common mediums that are used, so we talked about this tube, and inside of it was a gas. The most common gas utilized is helium neon, which has this wavelength of 632.8 nanometers, and it appears as red. Depth penetration, the claims are that this laser can actually reach a depth of 2 to 5 millimeters, which really is about the depth level of the skin, just below the epidermis. The second most common medium is gallium arsenide, and the wavelength is 904 nanometers. This is an infrared light. Depth of penetration is less. They think probably up to 1 centimeter, but not sure. Again, the helium neon is what is more commonly used. So when we're applying the laser therapy, we actually stay in contact with the skin or as close as possible without touching it if it's an open wound, which frequently we are treating skin wounds. The dosage is given in joules per centimeter squared, so this is typically just calculated in the machine, and they have a chart telling if you're treating this particular injury or syndrome, then you use this many joules per centimeter squared, and they tell you the time. So the time is really what you're looking for these treatments. Average, if you have to figure this out on your own though, average power is given by the machine. That's a fixed value, it doesn't change, and then you multiply that by a treatment time divided by the treatment area. So really your unknown becomes your time. You're given your average power, which is fixed. Your treatment area, you can put in a size there, and then you solve the equation for treatment time. The changes are based on unit power. Again, that's joules per centimeter squared, and all depends on the output power, which will be given, the time of light exposure, which you will be trying to solve using this equation and the size of the treatment area. So those are the three things that will come into importance when you're trying to figure out dosage. Here's another picture of low-level therapy, again treating primarily the skin area. Here's a single laser probe, which is commonly used. There's the on-off switch is right up here by your fingertip. You can use it with a grid method, which means you just divide the treatment area up into a grid of square centimeters, and you treat each box for the time that's been calculated by yourself or by the machine that it tells you how much time to deliver the laser. Oh, I forgot this also, you can use a scanning method, so you could take this laser level and scan it one direction over the treatment area, and then you can switch and scan it over the other direction at a 90-degree angle to the treatment area. This is called a cluster probe, where you've got many lasers coming out of a small area. These are actually becoming more popular, and I begin to see the cluster probes around if you do a lot of light therapy. All right, points of interest. Both the patient and the clinician need to wear protective goggles when administering laser therapy. Skin color can make a difference. Darker skin is going to absorb more light. Water content, hemoglobin contents will all affect the absorption of the laser light, so it's not an exact science. It's safe for use around pins, metal plates, implants, growth plates, and pacemakers. Typically, the treatment is 3 times a week for 4 to 8 weeks. If we compare diathermy and laser, and why would we necessarily compare those two? Because they're both considered electromagnetic therapies. So if we put these two therapies side by side and compare them, diathermy generates heat, whereas lasers don't. Diathermy will treat deep tissue, and lasers are treating very superficial tissues. And in diathermy, the waves are not visible, and we can, of course, see the laser waves. So just be aware of some of the differences between the use of diathermy and lasers. All right, so as we finish up this lecture, we'll just do an overview for phototherapy. Definition is the application of light for therapeutic purposes. Again, the effects are primarily tissue healing, but some people claim that it does help with pain. Advantages, that it's safe, there's no side effects, it's fairly easy to use, and cost effective. In fact, a lot of these laser units are connected now to the ultrasound and e-stim machines. So if you purchase one, there's that option of having that included as well. Disadvantages, effects on eyesight, which is why you have to wear the eye protection. Limited depth of penetration, again, we're talking millimeters, it's just not very deep. Indications are primarily for tensile strength of the scar tissue. Contraindications, irradiation directly into the eyes, irradiation of the uterus during pregnancy. If somebody has a cancerous lesion, we don't want to increase blood flow to that area. Organ transplant patients. Precaution is if somebody is photosensitive, meaning their skin really reacts poorly, or they're on medications that would cause them to be photosensitive, we would have to be careful with that. Epileptic patients on this slide are listed as precautions. On the previous one, I know is listed as a contraindication. So there's more to just a diagnosis of epilepsy to decide if it's a precaution or contraindication. So you'll just have to make a judgment call on that one. A recent steroid injection, we would not want to laser over at that area. Patients taking anti-inflammatory medications, sometimes that can interact. Again, if you're unsure, you could call the physician. An acute infection, we wouldn't want to cause an increase in blood flow there. And then patients who have a thyroid condition. There's some references there listed in case you want to look into this further. We do not have a laser unit here, although it is a modality that athletic trainers could use. So again, we'll be discussing case studies on Tuesday and Thursday of next week. So we'll devote that entire week to picking out modalities that would be best suited for particular cases, and laser now will be one of our options. So we would probably restrict the use of laser, just to help you out here, to superficial skin conditions, wound care. MRSA is one condition that they've utilized laser therapy for. Those of you that are on off-campus clinicals, if you're working in an athletic training room that does have laser, it would be interesting to find out from your preceptor when they've used laser, what they use it for. If they have wrestling at their facility, that might be, laser might be something that's more frequently used at those athletic training rooms. So if you can find that information out and then just let the class know, that would be extra benefits. So have a good weekend. We'll see you on Tuesday.